Okay, thanks so much everyone for joining us. Apologies for the delay. From the Legislative Building in Regina, we have Rural and Remote Health Minister Livingstone. We'll open with remarks from Minister Kaeding and Minister Livingstone as well, and then we'll open up for questions. Minister?
Good afternoon. Thank you for joining us. Today, we are reporting 42 new cases. The vast majority of the new cases are related to a growing outbreak in a number of Hutterite communities and other neighboring communities in southwest and west central Saskatchewan. The affected areas include the following RMs in all communities, including Hutterite communities within those RMs. The RMs of Maple Creek, Auvergne, Bigger, Eagle Creek, Grandview, Harris, Kelross, Lac Peltier, Newcomb, Purdue, Pleasant Valley, Prairiedale, and Tramping Lake. The affected area also includes the city of Swift Current. The SHA is working closely with the Hatarian Safety Council, local Hutterite leadership, local municipalities, and the business community to control the further spread of the virus. Of course, this includes aggressive testing and contact tracing, which has detected these positive cases and will likely find many more in the days ahead. Earlier today, the SHA announced that visits to long-term care homes in communities in the affected area will be temporarily restricted to outdoor visits and end-of-life care. It is crucial that we continue to keep the spread of COVID out of our seniors' homes and that we protect our loved ones in those facilities. Also today, we are asking everyone in the affected areas to take the following steps to protect yourself and others and reduce further spread of COVID-19. Stay in your home community as much as possible. Self-isolate and get tested if you are feeling unwell at all. Self-isolate and get tested if you've been in contact with anyone who is known to have tested positive. Limit your interpersonal contacts and group gatherings as much as possible. Of course, this is in addition to all of the other good practices that we should all be following, like physical distancing, washing our hands often, and wearing a mask when physical distancing isn't possible. At this point, we're not issuing any new public health orders or ordering any closure specific to that area. We believe that by following these recommendations, local residents can help get this outbreak under control. I know this is asking a lot. We had all hoped that we were through the most difficult phase of COVID-19, and with everything reopening, no one wants to take a step backward. But there is now an increased risk in southwest and west central Saskatchewan. So we're asking everyone there to take these steps for the next couple of weeks to get it back under control. Thank you to everyone in that part of the province for your cooperation. The SHA will continue to do its part through aggressive testing and contact tracing to identify positive cases and their close contacts who need to self-isolate. This outbreak is a reminder that the virus has not gone away, and once it starts to spread, it can spread quickly. While our overall case numbers have been low in Saskatchewan, that means that most of us remain vulnerable to exposure to COVID-19. So we all have to keep being careful.
Thank you, Mr. Kaeding. I'd like to begin by thanking healthcare workers across this province for the work they're doing above and beyond across the province on behalf of residents in the pandemic. I'd like to join the Minister in acknowledging the challenging situation that we face in the southwest and west central regions of the province. I'd also like to indicate that I'm encouraged to work with local Hutterite leadership and the Hatarian Safety Council. We had a meeting this morning with a number of leaders from across the province to discuss next steps and how we continue to collaborate with our aggressive case finding and active tracing. While the surge of cases is concerning, we should recognize that we are seeing a surge because we're seeing active case finding and aggressive testing in the area. You cannot contain what you cannot see. This is why efforts have scaled up in the areas, with testing sites now working longer hours and more days. We've also been deploying testing directly to affected areas whenever and wherever it's needed to lower barriers to access. Locally, plans are in place to enhance testing with additional resources from both the community as well as deploying staff from other areas of the province. We've also opened up testing to anyone who would like to be tested. This is starting to show an increase in the number of referrals across the province. Additional precautions have been put in place, including reintroducing significant visitor restrictions in long-term care and our healthcare facilities in the affected areas. Finally, I'd like to share, anecdotally, we should be encouraged when we face this situation in southwest and west central Saskatchewan. As of yesterday, our medical health officer in northern Saskatchewan shared that we no longer have active cases associated with that significant situation in the northwest of the province. While we know there's always areas that we can improve, there continue to be risks regardless of location across this province. The northwest situation tells us that we can fight this virus successfully if we work together with communities, healthcare practitioners, and the citizens of this province. Thank you.
Thank you. We had a delay on the phone. Minister, would we be able to just repeat the list of communities that you had?
Certainly. So we have the RMs of Maple Creek, Auvergne, Bigger, Eagle Creek, Grandview, Harris, Kelross, Lac Peltier, Newcomb, Purdue, Pleasant Valley, Prairiedale, and Tramping Lake, and it also includes the city of Swift Current.
Perfect, thanks. We will now move to questions, and we'll take our first question on the phone line.
We have Alessandra Carnero from CTV.
Hi there. My first question is, earlier today, I spoke with people who are living in the colonies, the Hutterite colonies, who have family members that are sick currently but have not gone for COVID-19 testing. They have the symptoms, they believe that they might have it, but have not gone to a testing center because they think it's safer for them to stay at home. They're wondering when a testing site will come to them and if that's going to happen.
So throughout the work with Hutterite colonies in the southwest and west central, we have been bringing staff on colony when invited. We haven't showed up unannounced, and we also have, as I've said, expanded testing centers across. In this specific case, what we will do is follow up with the Huttarian leadership, because if there is somebody that wants us to be there, we will certainly come and do whatever testing we can. Typically, we've been going door to door once on colony and doing risk assessments, harm reduction, reminding folks of public health orders and how to mitigate the spread of the disease. But certainly, there is no barrier for us to coming on actually right now other than being invited and knowing that people want us there.
Do you have a follow-up question, Alessandra?
So the next question is a little connected here. What's the reasoning behind not implementing stricter enforcement in the areas affected, like we saw in the far north a few months ago? Will that be happening, and will it be implemented?
Well, that's something that we're having ongoing conversations. Certainly, as Scott alluded to this morning, talking to the Huttarian Safety Council as well as Huttarian leadership. I know I've been engaged with community leadership in the area. We look at the Northwest, and the Northwest had asked for this to occur in their communities, and we were able to respond. I would say right now, with the limitations we've got in place, with the limitations we put into long-term care, I would say we're going to monitor how this is unfolding. Again, we look at the success that the Northwest has had, and with 0 cases now, knowing what it takes in that area specifically, we're able to get it under control. We're certainly hoping that with some of the limitations we put in place in the Southwest, that we can go with the current limitations, but we won't preclude that we would take more if we deem them to be necessary.
We'll take our next question on the line.
We have Ashley Martin with the Leader Post.
Hi, my first question is, on Monday, Dr. Shahab used the word sporadic to describe some of the other cases. So how many of these cases are connected to the communal living, and how many are sporadic?
So I don't have the exact delineation of numbers, but we can certainly follow up. But I can tell you that there is at least, the last I'd heard, there was more than 10 cases completely unrelated to cases on colony and completely unrelated to each other. So this is, as Dr. Shahab also mentioned earlier, I think it was 8 earlier this week. As we continue to see cases outside of both, the communal living arrangements, it's where we're seeing that contact tracing happen. So there are a number of cases outside, and they are spread across the Southwest. They're not isolated to a single area. So as we get farther into our aggressive contact tracing, we'll have more information, and we can have medical health officer follow up with the distribution of cases. The vast majority are on colony, but we do have cases across the community in the southwest and northwest or west central area, which is a concern as well. And as you know, when we go into those communities looking for contact tracing, it's important. It's why you're seeing some of the public service announcements where we don't have the ability to follow up, or people have been in restaurants or businesses. We are issuing public service announcements and notifications to the area in the province so that people are aware and that there has been COVID detected in that community and can come follow up for testing.
Do you have a follow-up question, Ashley?
Yeah, just relating to the way the numbers are reported in terms of these large regions, like we're seeing these clusters now kind of in the southwest and west central, but the south and central regions stretch across the province. So I just wanted to clarify, like, are there any cases right now in the southeast and east central areas, or are all of the numbers in the south and central in this kind of compact little area?
Specifically to do with this development in the southwest, one of them, the arm of Kelross, is considered to be in east central Saskatchewan.
So that's the only one that's like there are no cases like in Weyburn or Yorkton right now.
Not that we've identified through this, no.
We'll take our next question in the room.
I'm just wondering, again, back to the restrictions. We locked down a great portion of the province, and there were only 25 active cases at the time. Now we're seeing, almost 90 cases here in this smaller area. Why not apply the same rules or even have checkpoints, restrictions, things like that, or are those in place? So I think you might get people in the north complaining that there's different rules for different parts of the province.
Well, as I indicated before, the community leadership in the Northwest had almost uniformly asked for these restrictions to be put into place. And we've certainly been having these discussions with with the Safety Council, the How to Write Safety Council, with How to Write leadership, with community leadership in the area. And right now they haven't deemed that to be necessary. It's not to say that it couldn't be if we were not getting the cooperation, the tremendous cooperation actually that we have been with How to Writes in particular. We would maybe have to consider something like that, but right now I think with the cooperation and the willingness of these communities to to work with restrictions, to work with the testing in their communities, it hasn't. They have not asked for that to occur in their area.
What went wrong with this, as far as it getting to many different communities? Was there not enough communication? Was there a lack of leadership early on? What are you pointing to see? How this is our largest daily case. I know we're doing more testing and we're doing contact tracing, but I know this wasn't what we'd hoped for at this point.
Right. And I wouldn't say that anything has gone wrong. I mean, it's so difficult to predict as to how or where this is going to affect people. It's an ongoing. I guess we haven't called. We haven't termed it to be a short-term process. This is a long-term process that we have to go through, and again, always trying to understand how this is going to evolve, how it's transmitted. We can have a number of weeks gone by where we have absolute minimal number of cases, and then all of a sudden we see this expansion of cases. And there too, numbers we're certainly saying is that when you're certainly in these cases with our How to Write colonies, that when you start going door to door, you will now be finding more cases as well. So that certainly increased our numbers.
We'll take our next question on the line.
We have Connor O'Donovan with Global.
I touched on this a few times, but I noticed in the warning last night it mentioned aggressive contact tracing. Can you maybe speak a bit about that aggressive terminology and how the contact tracing, with this outbreak compared to kind of the usual contact tracing?
So I would say that the biggest difference is similar to the north and northwest is when we're invited into the communities and we can actually literally go door to door and do assessment, for example, in the northwest of living conditions and folks' ability to comply with public health orders, as well as to assess folks in those living arrangements. And testing way more people than we would if we were simply relying on walk-up testing is where we see these active case finding, seeing such a large number of cases. The same thing happened in our work with the communities of La Loche and Clearwater Dene Nation. But once we are invited onto the colonies and are working with the Hatarian leadership to help support the work that they're doing, it's not just testing those folks with symptoms, it's going door to door and doing assessment with aggressive contact tracing. And one of the things that is an advantage with the colony is, speaking to, what is the failure? I mean, one of the advantages of having it is the fact that, Hutterites didn't bring COVID to Saskatchewan. Just like any resident of this province, we have to be aware of what we need to do as individuals and as communities to prevent and mitigate the spread of this disease, and at no fault to themselves, because many of these colonies have been working hard throughout the COVID pandemic to institute restrictions on and off colony, wearing masks, properly wearing, washing hands and social distancing. But there have been, like everywhere else, there have been small breakdowns in that, after you ask people to do that for 12 weeks, there's been small breakdowns in that, just like there was in the outbreak in Saskatoon, where we had communal food. And so I say the biggest difference between aggressive and active is the fact that we're actually on colony, going door to door, and we typically don't do that. And when we learn from our experience up in La Loche, going door to door is much more successful. It allows us to identify cases early on, do aggressive contact tracing. So within 48 hours, we have 90% of contacts traced. It's a lot easier to do that in a contained communal environment. And it's one of the reasons why we believe that with this ongoing leadership from the Hatarian Safety Council and other Hutterite leaders across this province, we'll be successful in containing this, in the short term.
Do you have a follow-up question, Connor?
Sure, you sort of answered it there, but would you say that that door-to-door process is the biggest takeaway from the work that is done up in the north with the outbreaks there? Given that situation has really, come down in its severity.
Well, I think it's I actually think it's more than that. I think the community leadership and the leadership that was shown in the Northwest, similar to what we're seeing now in the Southwest and West Central, has gone a long way to helping support, the work we do. When you have the leaders supporting us coming into communal living or into family environments where we can actually do our testing and see and support those things that beyond the testing and contact tracing, what other things can we put in place to help people support mitigating the disease? That's to me would be the biggest success.
We'll take our next question from the phone lines.
We have Britton Gray with CJME.
Yeah, hi. I'm just wondering, with the Southwest kind of being a major tourist attraction, you're saying that not all these cases are involved with communal living situations. Is there a concern about the increased traffic in that area?
Well, I think, as we've reopened the economy and reopened the healthcare system and understand that we can't be under severe restrictions across COVID, and we're planning, and not planning, but we're living with COVID on a day-to-day basis, we just have to be cognizant of the fact that through the summer months, similar to PA, an area where we see lots of people going up to Lake Country, North Battleford, lots of people going up in the Lake Country, yourself around Southwest and the leisure activities there, is we just need to make sure people are reminded of the fact that we still are in a pandemic. We still know how to best contain that disease, and that is through public health restrictions, proper hand hygiene, social distancing, wearing a mask when you can't do that. So I think it's always important for folks to be diligent and aware of what's going on, and even more so during the summer months as we try to enjoy being outside and at the same time living with this virus, which is going to be with us for months.
Do you have a follow-up question, Britton?
Yeah, obviously with the travel and everything's kind of related, but how big of a concern or how high is the threat level that this could start spreading elsewhere right now?
Well, I think the threat level is evident by the fact that we've notified, this area of the province of our heightened level monitoring and heightened level of cases. With respect to the spread, I mean, again, how we do with respect to contact tracing and tracking down these cases, and more importantly, how people abide by our public health orders is going to be the biggest determinant of where the disease spreads. The disease doesn't move on its own. It takes a human being to do that. And, as long as folks are being diligent and coming in for testing. We've opened up testing for a reason. We want to find those cases as quickly as we can. We want to contact trace as quickly as I can. And those two components of the strategy, together with the third leg of the stool, which is public health orders and our hand hygiene and social distancing, are what's going to get us through these outbreaks. We've always been aware that these outbreaks and small clusters, surges, new cases are going to pop up on an ongoing basis, whether it's 5 a day or 40 a day. I mean, nobody wants to see the big numbers, but we're not surprised when we do see them when we're being as aggressive with contact tracing in that area of the province.
We'll take our next question on the line.
We have Anna McMillan with Global.
Hey there. The Saskatchewan Union of Nurses is calling on the province to implement mandatory masking regulations in places where physical distancing isn't possible. Just wondering if that's something that you folks are actively considering, and if not, why not?
I would say mask usage is just one of the tools that right now are available in the toolbox. I mean, we've covered extensively, the physical distancing aspect, the hand washing with soap, being aware of your surroundings. I think our chief medical health officer has been, fairly explicit as to where he sees a mask would be of the best benefit. As we continue to see, the evolving nature of this virus and the understanding of this virus, if it comes to that point where the chief medical health officer believes that it needs to be, taken to another level, then I would expect we would move to that. Scott, anything to add?
So just to add, we've heard Dr. Shahab and others talk about, the use of non-medical masks on a mandatory basis throughout the pandemic. And over again, we've talked about where the utility of masks comes in. And to Minister Kaeding's comments, we know masks, there's emerging evidence to say that non-medical masks do support containing the spread of the virus. However, that's in situations where you cannot maintain a 6-foot social distancing rule. So certainly having more of a voluntary policy, but keeping people aware of what's out there and how to protect themselves, I think is more important. I think, we have relied on individuals across this province to abide by social distancing and public health rules to contain the virus and ensure that the health system is not overwhelmed by the number of cases. The use of non-medical masks certainly has utility, in particular where we can't meet those requirements. And again, I think that's something that the medical health officers, Dr. Shahab as the chief medical health officer, continually monitor. And there may be changes to those recommendations down the road, but right now, the recommendations are non-mandatory, and in situations where you may feel uncomfortable or where you simply can't maintain that 6-foot distancing.
Do you have a follow-up question, Anna?
Yeah, I think that just kind of makes the assumption that people are going to follow the rules. And, you go to your local grocery store, you take a look at the beaches we've seen packed with people, and it's pretty clear that a lot of people aren't following the rules. They're not physically distancing. They're not wearing masks in places where maybe it would be a good idea. So at what point do you stop assuming people are going to do this voluntarily?
Well, I would say we have relied on people to adhere to the public health restrictions, coming for testing when they have a sniffle or any symptom, and now no symptoms at all, and ensure that as they're going on their day-to-day lives, they're cognizant of what their contacts are for the last couple of weeks, because that certainly supports the work we're going to do on an ongoing basis. And I would just highlight that, the work that the people of this province did together with healthcare employees from across this province and physicians across this province to help contain the disease and flatten the curve was built on the 3 pillars of contact tracing, testing, and adhering to public health orders. So as we've opened things up and have changed the rules, I'm not sure there's more lack of adherence, or it's just simply a matter of the fact that we've changed the rules and we are opening it up a bit. And what we're seeing in many situations is just people going on with their day-to-day lives and still living with COVID. I'm not aware of cases popping up in any situation like a beach or, for example, the rallies that were held earlier on, in June, where people were not abiding, where we had influxes of cases. So I think, we've always relied on people's best judgment and their adherence to this. And certainly there's been breakdowns in that throughout pandemic across the country, across the world. But I think, we should be proud of our record in Saskatchewan with what's been happening. And I'm not, to me, I think we would consider what would happen with a mandatory masking policy if we were starting to see things that we could definitely identify were strictly related to that type of transmission.
We'll take our last question on the phone.
We have David McIver with the Rosetown Eagle.
Hi, I'm just asking about specific numbers. How many of these new cases are in each of the rural municipalities of Biggar, Harris, Newcomb, and Pleasant Valley?
Yeah, I don't have those numbers here.
Yeah.
No.
You have another question, David? No? And we'll take the last question in the room. Adam, do you have another question?
Yes. Why isn't mask usage as per the safety precautions that are listed that went out today to the affected communities? Things like 2-meter distancing. Why is it not just even a suggestion on there? I think, Scott, you just mentioned that it's something that is another tool.
So specifically around using a mask when you can't maintain a 6 foot?
So there's a checklist of all the things people can do in Southwest.
It's a good reminder. I can tell you that from the conversations we had today with Hutterite leadership and the Humanitarian Safety Council, they have been doing that. They've actually been using masks where they haven't been able to maintain that social distancing. And I won't say it's an oversight because it's probably not something we've typically included in there, but I think it's a great point. We should include it as something that is a regular part of our sort of toolkit, and making sure folks know that if they can't maintain that 6 foot distance, they should be wearing a non-medical mask.
Are either of you concerned that this may cause a stigma towards people in the Hutterite community that are living in those areas when they go out and about, that people may be judging them or keeping distance because they're afraid they may be carrying COVID-19, as we've seen in other parts of the country?
There's certainly always that risk, but I look at what the leadership in those communities have done to date, and the responsibilities that they've taken, what their communities have done. They've done a lot of their own limitations within the communities on their own, and I think that will be respected in a number of the. I know it's respected in a number of these communities because I have talked to community leadership, and they certainly appreciate the efforts that Hutterites are doing to minimize the risk to outside of their communities and into the surrounding communities. So I would sincerely hope that we wouldn't experience that. But.
Good. Okay, thanks everyone. That concludes our conference for the day. As always, if you have any further follow-up questions, feel free to send them to Ministry of Health, the Saskatchewan Health Authority, or Media Relations and Executive Council. Thank you.